In Somerville, 25% of residents were born outside the United States. When it comes to health care, immigrants are often underserved because they do not know where to go or how the system works. The Cambridge Health Alliance launched the Volunteer Health Alliance, or VHA, program 14 years ago to change that. Reporter Kelly Thomas brings us their story.
The Volunteer Health Alliance program is a multicultural and multilingual group of highly trained community health volunteers. The current group of volunteers came from 20 different countries and speak 14 different languages. During each training cycle, 30 immigrant scholars opened 10 months attending free weekly classes at Somerville Hospital. VHA participants received diplomas in acknowledgement of their accomplishments at a recent ceremony in their honor.
So we're not just giving them information and knowledge, we're giving them some tools that they can actually bring out into the community, and we send them out into health fairs to do those screenings. So we teach them how to do blood pressure screenings as well as glucose and cholesterol.
The trained volunteers bring their screening skills to populations that are hard to reach. James Figueredo is the manager of health education and access for the Cambridge Health Alliance.
It has a large group of immigrants and volunteers who go out and disseminate health education messages, work on special projects, and also conduct health screenings within the communities of, we often have the so-called hard-to-reach communities. I like to say the hardly reached communities, because we actually find that when we have people from those communities, it's actually not so hard to reach them.
Lamia Reem moved to the USA from Morocco with her husband and her 3 children. Although she had no previous medical training, she completed the program and is now a volunteer in the VHA program.
If you see somebody struggling, and there is a lot of people who struggle with language, and they don't speak that much English, and when you show up as just like wearing a scarf, they're really relieved, and they really say, oh my God, this is like someone who can speak my language and can understand me better than another person who doesn't speak it. We go to church, we go to mosque, we go to health fair like around the area. It's really good for us, and we learn a lot of stuff from it.
Hugo Rengifo moved from Brazil in 2010 and became a health volunteer 3 years later. He now works for the program, setting up events and organizing classes.
The first thing that I did to them was like, I want that you create a good relation with the patient. He's going to have a companionship. We're going to create that companionship and friendship.
Those relationships build bridges between Somerville's diverse community and healthcare providers. Volunteers not only bring useful information to the community, they bring it back from the community to program organizers.
We have a tobacco prevention program, and a lot of our Muslim VHAs reminded us that a lot of people have tobacco in the form of using a hookah pipe. So it gets us to start asking questions about hookah pipe smoking. And so we're always learning from our VHAs, and I think a lot of times people think that we're bringing people in only to teach them, but it's really a bi-directional learning process with our volunteers.
The VHA program created a group called SOA, the Arabic word for together, in response to volunteer feedback. This group meets the needs of the emerging Muslim population in the Somerville area.
That SOA, it helps the Muslim community, and it's a bridge between like the religion, and it has like something that do with the religion and what's the Muslim people are willing or need to have in the hospital. Like, for example, we find out like that the Muslim people has like a problem with the gown that the patients wear, and we try to find a gown that it's modest, and it's really a good idea, and I'm really proud of the group that we can we're gonna implement to the Malden health clinic, and they're gonna use it as a gown for the Muslim community.
The program offers volunteers the chance to give back. It can also serve as a step forward for participants.
For a lot of people, it's also a way to get their foot back in the door in the healthcare field. About 1/3 of our volunteer health advisors are foreign-trained health professionals. So you might have someone who was a surgeon in Syria and might be a cashier at a supermarket here, or someone who is a cardiologist in one country and is at Dunkin' Donuts here.
Hiba Abelaban is a Syrian refugee. She received her medical degree from Damascus Medical School shortly before war broke out. She came to Boston and got a Master of Public Health at Northeastern University. Abelaban became a VHA volunteer to stay connected to medicine and to help others. She recently began working as the Emergency Department Patient Navigator for the Wheaton Hospital in Everett, but continues to volunteer with a VHA. She was recently honored as Volunteer of the Year by the program.
It started in January. We are in November. 10 months of great experience, and I gained a lot of valuable skills. My whole family in Syria, and after the war, there's a war in Syria, so a lot of this sadness going there. And when I see inspirational people like VHAs, it just makes me sometimes feel like there's still goodness in this world, and there's still people who care about others.
You remind the world that while nobody can do everything, everyone can do something. You teach the world that while being good is commendable, it's doing good that really counts. I hope all of you continue with us on this journey. You are the backbone of this organization.
For Somerville Neighborhood News, I'm Kelly Thomas.
The next Volunteer Health Alliance training program begins in late January. Visit www.challiance.org or call Chong Min Fu at 617-591-6755 for more information or to become a volunteer.